let me sort of try to frame this a different way. Alcohol reduces blood pressure. Okay, alcohol generally tends to reduce cardiovascular events for people. And during Prohibition, you could actually get a doctor's note for alcohol as a medicine. But alcohol is not a medicine. Okay, it's a recreational intoxicant. It has some positive biological qualities and some negative biological qualities. And, there was an argument, I think, 10 to 20 years ago, should we recommend that people drink moderately, 1 to 2 drinks a day? And I think for the most part, the medical profession has come down on the side of saying, let's not do that. There's too many non-cardiac negative side effects with alcohol.
Just on that note, though, Alex, in Canada right now, I know the safe alcohol drinking guidelines are 14 drinks a week for men and 9 drinks a week for women. So, basically two a day for men, 1.5 for women.
Right. So you're saying, okay, like we don't see huge negative consequences at that level. Okay, that's fine. Like that's a totally reasonable way to think about alcohol. But what we're not saying to people is this is a medicine. And I think that's where the confusion around really around high THC cannabis lies. And again, I don't mean to say that your friend's child is not benefiting. If you say he or she's benefiting, I believe you. What I'm saying is that that's not good enough for science. We need randomized controlled trials. And when those trials have been done, and a lot of them have been done, Joe, a lot of them have been done, they've almost unequivocally shown that cannabis doesn't work as a medicine. The only actual place where, beyond these sort of very limited conditions like chemotherapy-associated nausea, which obviously is terrible for people who have it, but isn't that common, fortunately, cannabis has been shown to work as a pain reliever, right? Probably for the same reasons that alcohol works as a pain reliever. It sort of dulls your awareness of your pain. But even in that study, or even in those studies, they're mostly done against placebo, not against opioids or against NSAIDs like ibuprofen. And there was a very big study for cannabis use in chronic pain over a multi-year period in Australia that came out last year that showed that people who used cannabis had more pain and used more opiates at the end of 4 years than people who didn't. So we're almost arguing about what medicine is.
Yeah, that study, though, had a lot of flaws in it. And the other thing is that you need to look at someone who is already using cannabis versus someone who is just using opioids. So if someone is just using opioids and they want to come off cannabis, there's multiple...
Come off opiates?
Come off of opiates with cannabis. Multiple studies have shown that can be effective. And that's not what was done in the Australian study that you're referring to.
Right, it's a more naturalistic approach.
Right, and also too, they didn't have access to medical marijuana during that whole time.
Right, so
those are all self-reported, right. And they were getting it from recreational sources.
Sure.
They weren't getting it from. That's a big distinction, though, right. Alex. Like they weren't getting it from a doctor who prescribed it to them. They were. This was a self-reported study, and people were getting cannabis that they didn't really know what they were getting. It wasn't. They weren't given any information from a doctor, and that's why it's a medicine, Alex, because right. You can tell a patient to take a certain amount of CBD every single day. And when you take a certain amount every single day, it can reduce your symptoms. And sometimes you need to increase that, and sometimes you need to decrease that.
I think we should
do that with all medicines.
We should be really clear about the distinction, though, between CBD and marijuana. I mean, we're really talking about the psychoactive version of it, right. And this is where right. You're saying it's negative.
Yes,
you're not really arguing that CBD
I'm
is
not.
Is
and I think Dr. Hart is talking about using this as a medicine. Certainly using the CBD. He's titrating his patients. He's monitoring them. He's not writing them an authorization and saying come back in a year when it's up. He's being a physician, and and I think to the extent that marijuana is medicine, we want people like him.
So you admit it's medicine?
No, I don't admit that.
But you just said that.
I don't think I just said that. I think I said to the extent. I'm trying to meet you halfway, but okay. I'll stop doing that. But I think you said something else that was really interesting to me, and this came up in the book too. So you're a clinician. You see sick people, and it's funny. My wife's a doctor too. She's a psychiatrist. That's how I sort of got in this. But my wife is a forensic psychiatrist, less than a clinician these days. Her job is to evaluate people, not so much to treat people. Your job is to treat people. You see sick people, you want to help them feel better. And you don't want to tell them there's nothing I can do for you. There's no hope for your pain. There's no hope for your PTSD. You want to help them. And I totally get that. But if you're an epidemiologist or a researcher who's trying to guide the views and the medical practice of hundreds of thousands of doctors, that's not good enough. So you need to step back. And I think this epidemiologist in Britain who I talked to, he said to me, I try not to draw conclusions because so often when I try to draw them, I'm wrong.
Yeah, and we need to be careful about that, right? And Alex, one thing that was mentioned in your book, was that you often cited the National Academies of Science and Engineering, right? But Ziva Cooper, she's a member of that committee.
Sure.
I mean, she put out on her Twitter. I mean, you can go to it. It's from January 9th of 2019. She says, in response in the recent New York Times editorial on cannabis, and as a committee member,
which by the way, that came out something that I wrote that came out of the book. No, I'm just trying to give people context of where it came from.
Right, but this is someone you cited.
No,
right?
I didn't cite her. I cited the report.
You cited the report, and she's a member of that. Okay.
Yes.
So she said, in response to the recent New York Times editorial on cannabis, as a committee member on NASM, which is that committee, and cannabinoids report, we did not conclude that cannabis causes schizophrenia. Then the Drug Alliance policy also said the report did not reach that conclusion. So, those are pretty two authoritative, sources that are saying that, in your book, you didn't cite the research properly, right? And then also they're saying that you left a lot out, right? They said that they have found an association between marijuana use and improved cognitive outcomes in individuals with psychotic disorders. That's straight from the same report. And, you failed to mention that, right? So I think that, when we're writing books or when we're giving out information, you want to do it from a balanced approach, and you don't want to just select, the small amount of material that's just going to support your study. We want to be truthful here. Joe's show has always been very, very truthful. I mean, Joe said right at the beginning, he doesn't think that that cannabis is perfect for everyone. And I don't think that either. And in Canada, we have really strict guidelines to follow. Basically no one prescribes THC to anyone under the age of 25. And all the conferences and stuff that I go to, we don't really have too many discussions about that. Like, the doctors don't really have much of a backlash about that. So
why is the distinction the age of 25? Why did they decide that age?
So 25 basically is when your brain
lobe.
is fully developed. And when you do look at the studies that do show an association between cannabis and psychosis, it's almost all in adolescence. I think that Alex only has one study in his book that shows an extremely weak correlation between an adult using cannabis and then developing any type of mental illness later. So 25 is a good age, but it's definitely a kind of a conservative ish age, but it's something that we follow, and I think that we've done well with that in Canada.
So Alex, why did you leave those conclusions out?
So I need to push back here.
Okay.
So the National Academy of Medicine report was drawn up by a committee of 16 researchers. Ziva Cooper is the one who's publicly said the report said this, but I think that we should have emphasized that it also said this. Okay. What I wrote in that New York Times op-ed, what I wrote in the book, is the plain language of the report. And the plain language is this: cannabis use is associated with a risk of developing schizophrenia and other psychoses. The higher the use, the greater the risk. I may have a word or two wrong in that because I'm doing it from memory, but that's what it said. And by the way, the committee was very clear. They separated depression. They said we don't see as nearly as high risk for depression as psychosis, even though, by the way, just today, JAMA Psychiatry, the Journal of the American Medical Association Psychiatry, put out a meta-analysis showing that cannabis is associated with depression and suicidal thinking, and actually suicide attempts at a 3.5 to 1 rate. This literally was released today. But to go back, Ziva is one of 16 members of that committee. So if you're going to say that I misquoted the report, which I didn't, I quoted it entirely accurately, you need to say, well, why aren't the other 15 members of that committee saying that I misquoted? Why is one person who works for the Cannabis Research Initiative at UCLA, which takes money from cannabis investors and users, she's the one who said that I misquoted it? Maybe we should ask why the other members of the committee are not speaking out against my book.
Well, I think that she was just one of the 16 members that came out, but you can't really expect all the other members to potentially come out with that as well.
Why not?
Well, some people will.
If I did something wrong, if I misquoted them.
Well, some people will and some people won't. Some people have, the personality. Some people have the platform. Like, Ziva has a bunch of followers on her Twitter. People know who she is. A lot of people who do research actually are not into social media at all. Like, I don't think you were at all before you had your book, were you?
Yeah. I mean, I was a novelist, right? So I was promoting my book.
So you weren't into social media at all. So, I don't think that most people on that committee are into social media. Ziva just happens to be, and I even spoke to Ziva on the phone about this, and and she said that I don't that she agrees with everything that was in the report, but she doesn't agree with your conclusions. And to go back to
conclusions are quoted from the report,
but you're only quoting the parts that cite that back your opinions. You're not quoting the entire part. Like, you left, why did you leave out the part that said they have found an association between marijuana use and improved cognitive outcomes in individuals with psychotic disorders, right? So you're leaving out that part. So why did you leave that part out?
You leave out that part.
If you can find me a psychiatrist who thinks that it's a good idea for somebody with an active psychotic disorder to use
why did you leave out that part?
But why'd you leave out that part?
Well, my book presents, it makes a case, right? It makes a case that this is a big issue that we have not heard about at all. And the reasons that we haven't heard about it have a lot to do with the advocacy community and the way they've presented this data for 25 years. I wrote a book that is trying to break through a lot of noise.
So, but still, to get a balanced approach, did you decide that you were only going to write about things that confirm the belief that you held when you were writing this and what you were trying to push in the title of the book and in the conclusion of the book?
I think that's a really great question. I say in the introduction of the book, this book is not balanced.
Okay.
There's not a lot of evidence in there. If you want to read about how indica and sativa strains are different, and you're not going to read that in this book. But I also want to say this. I didn't come at this, and I say this in the introduction of the book too, as an anti-cannabis crusader. In fact, when my wife said to me, as she said to me over and over again in 2014 and 15 and 16, these are the cases that I'm seeing. These are the terrible things that people are doing after cannabis use. I sort of said to her, first of all, why do I always have to hear about this at the dinner table? Mm-hmm. But more importantly, why is it that maybe these people were using other drugs? Maybe you're seeing a slice of the population that's not representative. Why is it that I should believe this? This sounds like reefer madness to me. And ultimately, my wife, who's the one who went to, she actually, as I was talking to Dr. Hart about this, she grew up in Newfoundland too. She went to the Memorial University of Newfoundland Medical School, and she went to Harvard and Columbia for her postgraduate training. Eventually she got tired of me yapping back at her, and she said, why don't you go read the studies yourself? And it was that led me to write this book, because when I read the studies, I could not believe the strength of the evidence, Joe.
But you're still, even in saying that, you're still seeing positive results that you're excluding.
Again, there's this one sentence. I mean, it's not just one sentence, but there are a few sentences about how it may be that cannabis helps people's positive. It helps cognition in people with psychosis. Maybe not.
Wouldn't that qualify as medicine?
Not if it's it wouldn't be approved as medicine if it's causing them to have other psychotic episodes.
But if these people have psychotic breaks and it improves cognitive function in people with psychotic breaks,
so
wouldn't that be something that you would prescribe to someone?
No. Again, you need to think about how the FDA is looking at medicine.
No, I understand the FDA's position.
Sure.
But I mean, looking at it as medicine, I mean, if we could prove this through studies and through some sort of clinical trials.
If it is improving your IQ 2 points on a test, and I'm not saying it is. I'm not. I think we'd have to look it up.
I'd have to look at that. I'm not sure what the exact outcomes are.
But at the same time, it's making you floridly.
Nap.
Right. No, it's true.
2
But at the
points.
same time, it's making you floridly psychotic. That's not medicine.
Well, it's not necessarily at the same time. One of the things that I read about schizophrenia was that people were trying to make a correlation between marijuana use and schizophrenia, but the problem with that correlation, in what I read, and maybe you could help me on this, was that it's the exact same number that you find in the general population. It's essentially 1% of the general population has schizophrenia, which is 1 out of 100 people. And when you have marijuana users, you see it's essentially that same number mirrored. And so they're saying in a small number of people. Hold on, but let me get. In a small number of people, what they were saying essentially, in what I read, was that marijuana use was associated with the onset of schizophrenia. They were disputing this in this study because they were saying, because the same number is mirrored in the general population. Again, correlation does not equal causation, right?
Dr. Hart, I think you got to tell them that's not true.
So
well, tell me what that means.
So traditionally, yes, when you look up the stats, you'll see that the people who use cannabis versus the people who don't use cannabis have very similar rates. But getting to the exact rates, so in the U.S. they say that the range for schizophrenia is between 0.25 to 0.64%. Globally, they say it's 0.33 to 0.75%. So, right there, it's, apparently lower in the U.S. And the U.S. has the highest percentage of cannabis consumption in the world. And the U.S. also has a lot of people that are using high potency THC. So, I think that, we really need to be careful about throwing out, stats like that, because, when you do look at the stats that we have, it shows that even though, there's a lot of cannabis use in the United States, schizophrenia rates have remained the same.
So I have to push back really hard
Please.
on this. This is one of the great myths of legalization.
Okay.
No one knows what the schizophrenia or psychosis rate is in the U.S.
Right,
okay?
because a lot of people aren't treated.
People aren't treated. People get different diagnoses at different times. Mm-hmm. We have bad health care in this country, and we have a lot of protections around mental health. In fact, in 2017, the National Institutes of Mental Health suddenly changed its estimate for the percentage of people with schizophrenia in the U.S. from 1.1% to 0.3%. They did it with no public notice, and then this researcher said, hey, this is a miracle. They just cured 2 million people with schizophrenia. And then in response to that, the director of the NIMH said, well, we actually don't know how many people have schizophrenia in the United States. Nobody knows. Nobody knows if the rate is increasing. Nobody knows if it's decreasing. The only countries where they can count noses on this with any accuracy are in Northern Europe, because they have good health care, because they have slightly, less protections around sort of individual privacy and mental health privacy. And so they are able to count cases. And in Denmark and Finland, which are the two places where they've actually done this research in the last 20 years, they've shown increasing rates of schizophrenia between about 1995 and about 2010. And that goes side by side with increasing rates of cannabis use in the 90s. So the people who are saying that there's no evidence of population-wide increases in psychosis are just wrong. That's
but isn't
just
it possible
wrong.
that there's other factors?
Oh, absolutely.
I mean, environmental factors. There's a bunch of other different things.
Let me be clear on this. We absolutely don't have the evidence at this point to say that cannabis use in the U.S. is causing a population-level increase in psychosis and schizophrenia, which are, by the way, those are sort of different illnesses, and we can talk about that too. So we don't have the evidence to say there's a definite increase. But what I'm saying is that what you have been told, that there is no increase in schizophrenia or psychosis rates in the U.S., we don't know if that's true or not. We just don't know.
Let me ask you this. There has been proven that there's an increase in marijuana use. Is that correct?
Yes,
correct.
Absolutely.
Yes. When did the increase begin, and what percentage is that increase?
So there was an increase in the 90s, an increase in use and in potency. Use sort of bottomed out around 1991, and then there was sort of a flat.
Bottomed out? Mean it hasn't increased since 91 to 2019?
It's gone up about 50% since 92.
Yeah,
roughly.
no,
that's a lot.
That's a lot.
Well, wouldn't you expect a corresponding increase in schizophrenia if there was any sort of correlation?
So hold on, let me walk you through. Okay, it bottomed out in the early 90s.
Okay,
increased in the 90s, flattened out between about 2000, 2006, and since then has been going up again, especially in, let's say, the last 3-4 years. And the other thing is that potency in the last 15 years has gone way up. I don't think anybody would dispute that.
Right.
Okay.
Has schizophrenia gone up?
So what I'm saying to you is we don't know. There is evidence. There is there's now evidence on a population level basis in those other countries that schizophrenia and psychosis has gone up. And there's, for the first time in 2017, there's data showing that serious mental illness, which is not the same as psychosis or schizophrenia, in the U.S. doubled between 2008 and 2017 in people aged 18 to 25. And those are the people who are most likely to be using. So for the first time, there's actually evidence of what you're talking about, which is a population-wide increase. Now, again, I'm not going to say...
Can I get you to clarify it?
Sure.
When you say serious mental health,
So serious mental illness, so this was defined... there's a study called the National Survey on Drug Use and Health. It's done every year, covers 70,000 people, federal government funds it. It's sort of the best data source we have on all this stuff. It showed that, and they're not counting cases either. Let me just be as clear as I can on this. Nobody's counting schizophrenia cases on a national or even state level basis in the U.S. But you say to people, did you have depression so bad that you couldn't get out of bed? Did you, were you hospitalized this year for any inpatient psychiatric reason? And if you look at those numbers, in 2008, 3.7%, I remember maybe it was 3.8% of Americans 18 to 25 reported at least one symptom. So they were categorized as having serious mental illness that year. In 2017, that number was 7.5%. So that's a doubling. So again, I am not going to say that proves that the increase in cannabis use has caused this population level increase. But something bad has happened. And if you look at kids 12 to 17, interestingly, they, over that time period, didn't have a big increase in cannabis use. In general, teenagers are pretty healthy now, although Juul and vaping may be undoing that. And those kids didn't have a population level increase in serious mental illness.
Can I stop you for a second there? Because there's other factors.
Oh, sure.
One of the big one is Yuval Noah Harari has a great book, 21 Lessons for the 21st Century.
I read that.
It's great. And one of the things they talk about is the onset of social media. Jonathan Haidt talked about that as well.
Yeah.
And that the onset of social media, it was actually more Haidt than Yuval Harari. But the Jonathan Haidt talks about it with young people.
Yeah,
I think it's the coddling of the American mind. Yeah. I think that social media and the pressures of social media have led an incredible amount of young people to serious mental distress and, serious anxiety, serious depression, and suicide amongst young girls has increased some 50%, according to Haidt, over the period of 2007 to I think 2000, whenever his book was written. And I think they're directly correlating that to the pressures of social media and to, anonymous online bullying and all these different factors that are affecting kids.
Yeah.
So I think that could be considered a far more significant new form of distress to children and young people than even marijuana.
I think it does it twofold, because I think that what makes people really depressed, maybe more so than anxious, but definitely both, is that when you compare yourself to someone else, and people. Obviously that we've done that. All humans have done that. Since history began. But now everything is online. You can compare your life to everyone, and people are doing it all the time. And even worse than that, and we should talk about this too, is that the income gap is getting wider. So it's like people's lives, not only are they getting better than other people's lives, but now it's on display so everyone can see it. Whereas before, maybe you wouldn't have seen it because it wasn't on social media, but now it's on social media. So you have this huge income gap that just keeps getting bigger and bigger and bigger, and then you have people going on social media and they're comparing themselves. And you're absolutely right, especially in that age population. I mean, people under the age of 30. They're definitely, they're being bullied online. Like I see it every day in my office, like literally every day people are being bullied online. And that's, something that I never had, to deal with growing up.
Yeah.
And, a lot of kids do have to deal with that. Just one more note too on the since Colorado has legalized cannabis, this is important for this subject and this topic. They've actually seen marijuana rates decrease. So it's important for people to know that
no. They haven't.
Yeah,
are you talking about
teen
use or overall use? Overall use has gone up. Teen use is flat. Overall use is up.
Okay, yeah, I'm talking about teen use.
Okay,
That's the category that we're talking about, under 30, right? So teen use, would classify as part of that category. So, in Colorado, we have seen a decrease.
Do you think that's because of the lack of, because it's not illegal, it's not as exciting to them?
Part of it, for sure, you know, and I mean, part of it, like one worry I had, I haven't looked into the statistics yet, was, when you're growing up and when you're in high school, if you want to be part of the cool crowd, so to say, you usually drink or you smoke pot. That's what people do. I hope that doesn't change because pot's seen as medicine. I hope that people don't move on to or do something harsher because they don't see pot as cool anymore.
Right. There's no stigma attached to it because it's legal.
Yeah. So I got to push back on a couple of things.
Please.
So everything you say about social media it sort of intuitively sounds correct, right? Mm-hmm. The problem is the data doesn't support this at all. The data shows that teenagers, another 12 to 17, those kids are healthier than they were 10 or 20 or 30 years ago. They drink less, they smoke less, they have sex later, they have fewer abortions. They are healthier. Okay. And their mental health doesn't seem to have changed that much based on the NSDUH data, okay? The data shows a big change in kids 18 to 25. They go to college, something goes wrong for a lot of those kids, at least in the last few years. Now,
but wait a minute, when you're talking about suicide rates, suicide rates they're especially with young girls who are apparently more affected by social media. They have gone up significantly since the rise of social media. That is the big factor.
The people who are most likely,
hold on a second, more so than cannabis use, and then that's a fact.
So you're talking about a tiny number. The people who commit,
it's not a tiny number. It's a 50% increase of people that commit suicide that are young girls.
The people who commit suicide in the United States are middle-aged white men. And
but young girl. But wait a minute, you're discounting these young girls that are committing suicide to fit your statistics or to fit your conclusions.
No, what I'm saying is that's a tiny number.
But
Joe.
it's a 50% increase. Is not a tiny amount.
This is something we can look up.
Well, let's find out what the numbers are because when Jonathan Haidt was on the podcast and he discussed it, I mean, he showed this chart and it's an alarming increase directly correlating with the increase in use of social media.
Sure, and by the way,
why would you push back against that? That seems to be a factor.
What I'm pushing back against is the idea that kids 12 to 17 generally are less healthy than they were 10 or 20 years ago.
No one's saying they're less healthy. You just said they're more healthy.
Yeah, I'm saying they're more healthy.
Right.
And I'm also
we're saying that mental health has nothing to do with cardiovascular fitness.
I mean mentally healthy. I mean they're less likely to use drugs. They're less likely to have sex.
But they're more likely to commit suicide.
Oh, that is a tiny number.
What are you talking about? If it's 50% increase, that's a huge difference.
We should look up the number if we're gonna.
Look, Jonathan Haidt's work is like very well respected.
What I'm saying to you is that there's a clear increase in psychological distress in kids and young adults 18 to 25. Okay, there's a clear increase. And those are the people who are most likely to be using cannabis right now.
Those are the people that are most likely on social media as well.
Sure. And that's a stressful period of your life, Alex. Like 12 to 17, you're usually living at home. Like 18 to 25, then you got to go to university. You got to deal with all these courses and stuff.
I'm willing to concede that, and I've said at the beginning of the program, that I think that marijuana with some people is not beneficial and in fact could be negative. But I don't understand why you're not willing to admit that social media has a significant and unprecedented impact on young people that we've never seen before.
I would totally agree with that. But I don't think that you can say based on the population level data that the impact is all negative. It may be,
Who's saying that the impact is all negative? What we're saying is a 50% increase in suicide with young girls.
Right. But
that's huge.
Let me give you an example. When you were 15 or I was 15, maybe you got really drunk, right, and wound up in a bathtub. Like maybe kids today are less likely to do that because of social media because they know it's going to be on Instagram forever.
I don't think that's true. I don't think that's proven. And
no,
I don't think there's anything that would point to that.
What I can tell you is proven is that kids today, I'm talking about teens, 12 to 17, have less psychological distress by all these measures I'm talking about their actual behaviors are better or worse. That's a moral judgment, but they're healthier than they were 10 or 20 or 30 years ago. They're less likely to have sex. They're less when they're 14, which I think most people say is a good thing. They're less likely to be drinking. They're less likely to be smoking. Those are good things.
Well, less likely to be drinking, less likely to be smoking, less likely to have sex does not correlate to positive mental outlook and less suicide.
Well, yes, I agree there. Let's look at the numbers. Okay.
But depression and suicide are very difficult things to measure, right?
Depression, suicide's actually pretty easy to measure. It's a hard number. Depression is
look at this
more
spike.
Complicated.
The bottom number is in females.
I mean, this is what I'm saying. The death rate. First of all, this is okay. The death rate for girls age 15 to 19 is 4 per 100,000. Joe.
It's at a 40-year high.
Right. So, I mean, you'd be hard put to say that's a huge spike. It was 3 per 100,000 in 1975, and it's a little bit over 4 in 2015. That's one case per 100,000 girls.
Yeah, I don't know what the actual facts are. I'm looking at this right now. The suicide rates for teens 15 to 19 years old. This is something that we'd have to study.
Sure. And
have this discussion.
What I'm telling you is
giant spike for boys in the 1990s. What the fuck is that about? 95.
What I'm telling you is, if you put middle-aged men on this chart, you'd have to blow out the ceiling. Like the suicide crisis is unfortunately a crisis of age.
Okay, I would agree with that. I think we actually talked about that yesterday with Andrew Yang, that suicide amongst men in their 50s, and then they start to feel useless. And especially if they lose their jobs. But what Jonathan Haidt is pointing to is a direct correlation between social media use, depression, and suicide amongst young girls.
So thank you for finding that. By the way.
What is it?
This is the article it's from. From this.
Suicide rate for teen girls, the highest it's been in 40 years, is social media to blame.
Right. So.
Okay.
I clicked on that link.
New data released Thursday by the Atlanta-based Centers for Disease Control and Prevention. Suicide rates amongst 15 to 19-year-old girls doubled between 2007 and 2015, reaching a 40-year high. I would say that's significant.
Again, I would, and it's obviously a terrible thing when anybody commits suicide. But we're talking about 2 per 100,000.
I understand. Actually, it's 5.
Well, it went from 2 to 4.
Okay, sure. That means for every 100,000 American girls in 2015, 5 committed suicide. That's not a very high number, but I mean that's also someone who's pushed to the extreme of taking their life. How many girls are experiencing severe depression but don't commit suicide? That's the real factor, because this is what hate directly connects to social media. Again, the 50% increase, you're talking about a relatively small number because not as many girls commit suicide as men. But still, you were talking about depression,
right?
And you were talking about these significant factors that would lead people to have poor mental health.
Yeah.
This could be a huge factor in this, right?
And I think that too, it leads people to suicidal ideations and depression and anxiety. I mean, right here we're just looking at suicide, which is the worst endpoint possible,
which is very rare amongst girls. Period.
Yes, absolutely.
Right, or less. Less common.
It is. Yes, men do commit suicide more than women do, but we really have to be careful about that, because again, suicide is the end. It's the worst thing that could possibly happen. So what about all the things leading up to it? Are there people who don't commit suicide but suffer from terrible depression, suffer from terrible anxiety, suffer from terrible insomnia? Those people are not accounted for in that graph.
I agree, and what I'm saying is that cannabis use has spiked in the United States in the last 15 years, and teens notwithstanding, we've seen a large degradation in a number of these social outcomes. And now just today, we have a JAMA Psychiatry paper that looked at a bunch of other studies that said cannabis use in teenagers is associated with depression, suicidal ideation, and suicide attempts in people once they get to 18 to 30. Okay,
but so again, could possibly be a factor.
What's that?
It could possibly be a factor.
Sure.
Yes, but it might also be that these kids are depressed because of social media and they're using cannabis.
Or they're depressed because their friends died from opioid overdose. There's a lot of potential.
Alex, we are conceding the fact that, you just said again, that study was done on adolescents. Joe and I have both conceded multiple times that, we do not think high THC cannabis is good for people in that age category. But, just to to back up just a little bit again, I don't, like I said earlier, that I don't prescribe THC generally to anyone under the age of 25, and most other doctors in Canada don't. But I think that we should be prescribing CBD to these kids. Like a lot of those kids, who have suicidal ideations, depression. I mean, you could never do a study on it, but how many of those kids wouldn't have committed suicide or wouldn't be feeling this way if they were using CBD? Because we know SSRI, selective serotonin reuptake inhibitors, which are the most commonly prescribed medication for depression and anxiety, even in adolescence. We know that they can increase suicidal ideation. That's been shown. Sure. I mean, it's written right on the package. So again, like as a clinician, you have to treat your patients. If you're just treating people with something that's not effective or that has horrible side effects, you're going to look at other alternative treatments. A lot of people have had excellent results with CBD in that age category. I've had it done in my practice, and lots of other physicians have had it done in their practice. So it's really important that when we're talking about teenagers and when you're talking about that study, you're talking about high potency THC in adolescence. That's where Joe and I both concede that THC is not a good medicine.
Look, if GW Pharma or somebody else can do a study with CBD in depression or some other cannabinoids, a non-intoxicating cannabinoid in depression, and get it approved for that, that'd be great. We need all the treatments for depression and boy, do we need treatments for psychosis that we can get. I totally agree with that. And I'm really glad to hear you say you don't think that adolescents should be using high potency
or any hard drugs.
Or any hard drugs.
Especially alcohol.
No, and they should try to also, stay away from the other medications.
So I want to push back